Hello, everyone. My name is Corey Thornton. I'm the Senior Editor for Open Minds, and welcome to today's Circle Executive Roundtable, How to Improve the Performance of Your Existing Whole Person Care, Assessing Your Program Positioning, featuring Open Minds Senior Associates Deanne, Cornette, and Christy. Before we get started, I have a few housekeeping reminders. Your audio will be muted for today's briefing. However, if you have any questions, please submit them, and if time permits, we will answer those at the end of the presentation. And finally, the slides and the recording for today's roundtable will be archived and available for elite members on the Open Minds website starting tomorrow. And with that, here's Christy and Deanne.
Thank you, Corey. So good morning, everyone. My name is Christy. I'm a Senior Associate here at Open Minds, and I'm joined today by Deanne Cornette, also a Senior Associate with Open Minds. And we're actually pretty excited to have you join us today. This webinar is a little bit different because it's actually designed for organizations that have a current integrated practice and are looking for ideas and opportunities and how to ramp up their performance. So getting more value out of an existing whole person care practice. And I'm trying to see why this will not go forward. There we go. This is our agenda for today, the areas that we'll be covering. And these are our learning objectives. And I wanted to pause for just a couple minutes on learning objectives because there's really, in the first one, understanding best practice operations and common features. There are really 4 areas that you'll hear both Deanne and I talk about across all the domains of whole person care that we'll be discussing today, because these are the areas that we most commonly see as problem areas for organizations delivering integrated and whole person care. The first whole area is really around issues with standardization and documenting team roles and key processes. And when I say documenting, I mean put it in writing. It's really important to document team roles and identify those key workflows and make sure that you have them in writing. And there's 2 reasons why. First, because the tendency always is to revert to how things were always done, the old ways of delivering care, how we always did things around here. Second, writing down your key processes and workflows allows you to really analyze them to make sure that they are the most efficient way to go about delivering that particular service. And in order to move from a fee-for-service type payment model into some of the alternative payment models that we'll talk about a little bit later, you'll need to gain the most efficiency that you can in order to be successful along the way. Second key area, not having enough patient volume in your integrated practice to cover the cost of delivering that service. And Deanne is going to spend some time talking about that a little bit later. Third, a business model that is financially sustainable. So we'll talk more about the importance of feasibility testing for financial return a little bit later on. And then the fourth real common area that we see is organizations that don't move outside of their clinic walls. So whether you're addressing social determinants of health in the patients that you serve, or bringing in data from outside providers who are also serving those patients, you'll need to think about ways of extending your reach into home and community settings. So those are the 4 probably most common areas that we see, and we'll be elaborating on that as we go along. So wanted to start off with why it makes sense to maximize your investment, the investments you've already made in whole person care. And the reasons your organization chose to move into an integrated model of care delivery, the original reasons you chose are still very valid today. We know that competition across the board in specialty care services has really ramped up, and that the technology, in fact, is changing the way that healthcare is delivered. There's also just been a broad interest, particularly among payers, in more integrated whole person approaches to delivering services. And then finally, what we'll be talking about extensively as we move forward with this webinar, the formula for success in whole person care is the same as the formula for success in value-based payment. So whole person care really lays a strong foundation for organizations to be successful in VBR. As we said, whole person care approaches are really increasing. A lot of this is driven by payers and cost. And when we say cost, we're really talking about that small group of consumers that utilize the vast majority of healthcare resources. So the 10% that are known as high cost populations. And most of those individuals have multiple behavioral, neurologic, cognitive disability, as well as medical comorbidity. And so those are the reasons they become high cost. And then finally, most of the initial studies, outcome studies on integrated care models, have very positive findings for the success of whole person care. So we are seeing real improvement in health status, clinical outcomes, and then reduced total cost of care, particularly for those complex patients. And that just leads us to the question of how do you really define value in whole person care and value-based payment? Well, it depends on the audience that you're speaking to, but what we really find for providers is that whole person care gives the provider ownership, control over more of the factors and a broader array of the services being delivered, so that they're able to actually drive outcomes and drive reduced costs. And you do that by managing those processes like utilization, the services you deliver, the staff that deliver the services, and those are the things that health plans pay for. I wanted to spend just a little bit of time on a survey that Open Minds conducted last fall, 2023, in the fall. It was the third survey Open Minds has conducted on the movement to whole person care in the specialty healthcare arena. And it is the only national study that actually charts the course of healthcare integration in behavioral health, addiction, IDD providers, et cetera. And what we really see is that more and more organizations in 2023 have started an actual integration process. It's 42%, and another 30% are in the planning stage. So a lot more activity of organizations moving to whole person care models. And then we also see that a shrinking number say, well, we're not going to do any integration at all. So in 2023, that was 5%. It was triple that just a few years before. So same survey, what we find is that organizations that are adopting more of a template approach, so taking a model and recreating it in their own organization, are choosing the certified community behavioral health pathway to whole person care. And then, of course, one of the, you'll hear us on this theme of complex care over and over again, one of the really more significant changes that we've seen across healthcare in general over the past several years is that more intensive focus on serving complex care populations. So the people in this group, as we said before, have multiple medical conditions, along with high levels of social need, behavioral health, disability. So in this survey from 2023, over half of the specialty care providers that responded have actually developed complex care programs because they recognized that need in the individuals they were serving as part of their whole person care practice. Get rid of that. So in some cases, it's having a special care management program for people who are more high cost, and ED, inpatient visit utilization management programs are also very common. Okay, we wanted to talk a little bit about what are those common features of high performing whole person care programs. And one of the really hallmark characteristics is that integration connects providers across multiple organizations and disciplines. So that kind of, in essence, is the communication and care coordination area of whole person care. So as part of this, you see expanded care teams, some of them physically expanded by adding staff, others virtually expanded by adding staff through a virtual mechanism. And then you also see shared care plans. It's, again, the importance of documenting team roles and workflows in this step of integrated care is vitally important, in part because you don't want team members to be confused about who has what job in a team that's relatively new to the organization and includes new types of staff like care coordinators. You also want to be able to document those workflows and standard processes for responding to very common situations. So as a good example, it helps the organization manage the process more efficiently. If, for example, you have a documented process for responding and closing care gaps. So how you identify the population that has care gaps, how you intervene or set appointments or whatever the strategy is you will use, and how you close that gap in care. So having a standard protocol for closing gaps in care, number one, the organization is going to know the gap actually got closed because you had a standard process and you followed it. And I think the other important thing to remember about care gaps and the need for defined protocols is most care gaps are HEDIS measures. So an example would be the colorectal cancer screening or a retinal eye exam in a person with diabetes. Those are HEDIS measures, and when a provider is able to help a health plan improve their performance on HEDIS, which means the health plan will earn bonuses for that, you become a highly preferred provider in the eyes of that payer. Second hallmark of an integrated delivery model is really taking that whole person approach to health. So a broader view, a more comprehensive view of health, of patient health than in traditional services. And probably the key characteristic here is either staff or a process for screening and referral of patients for social determinants of health. So the social risk areas like whether they have housing or they're homeless, their diet, what does their diet look like, sedentary lifestyles, all those either behavior or environmental factors that really drive poor health outcomes. Back to complex care programming, this is a real hallmark of whole person care programs that focus on the highest cost patients that drive most of medical healthcare spending. Again, the need to have standardized processes to manage populations. An example would be a process for your populations that frequently visit the emergency department instead of coming in to see their primary care, or that are frequently hospitalized. So at Open Minds, we actually recommend having dedicated staff whose job it is to work with complex care populations. So you carve it out of the rest of the population that's receiving integrated services in your clinic. And then even having special integration or complex care huddles or meetings that allow the team to come together, talk about progress, lack of progress for that specific patient, and then what steps to take next, what kind of clinical intervention we put in place to help address whatever the issue is that is making them a high cost patient. And then the final piece on complex care program, which we talked about way back at the beginning, was really adding staff to extend your clinic services into the home and community environment. And this is particularly important for high cost, high need populations, your complex care population. So I don't know that I mentioned, I live here in Phoenix, Arizona, and we're sort of known for our pretty warm summers. And I can't imagine how much money we saved our health plans over the years simply by having case managers visit their complex patients in July to make sure that the air conditioner worked. Because if their air conditioner didn't work, they were in the ED, which of course is a higher cost environment. So the flip side really of taking services into the community is bringing the data from care providers in the community that are also seeing your patients, bringing that into your practice and into your electronic health record. Areas that we would recommend to make this happen would be developing a relationship with your local health information exchange, your HIE, or possibly working with your payer on any data feeds that they're willing to share. It allows the organization to be on top of key events, ideally in real time when they're happening. So a great example of that would be a real-time notice when an individual's discharged from a hospital. Because again, a very common behavioral health HEDIS measure is follow-up following a hospital discharge within 7 or 30 days. Very difficult to do if you don't know when the discharge actually occurred. So technology is an area we would spend a lot of time on, working with organizations that are, actively delivering whole person care, because it can be one of the most expensive parts of whole person care. There are definitely ways to start small. In my organization, we built our original population health tools in Excel. But over time, if you want to scale, you want to grow your either population health or your whole person care services, you'll really need to make investments in technology. So having a solid plan for what type of technology, at what cost, at what price point, based on the stage of whole person care integration you're at today, is an important point for overall success. And then finally, we talked a little bit earlier about the importance of the business model that you use in whole person care. And so whole person care financing really has 3 parts. The first one is your operational budget. So, what are the infrastructure costs that you make on a one-time basis? What is it on an ongoing basis to staff, medical supplies, equipment, etc., in order to deliver your whole person care model? And this is an area most organizations have this down. I don't know that we've ever worked with an organization that didn't have an operating budget. Not so much the pro forma side of things. The pro forma is what allows you to test financial scenarios as you ramp up your whole person care services. So how long, if I have a 3-year pro forma, how long is it going to take me to get to break even? It is not uncommon in the early years of delivering whole person care, your first year or two, to really only have maybe 25% penetration in the target population you've identified of people who are actually taking advantage of your whole person care services. And again, Deanne will speak extensively on ramping up the population volume, but that's going to impact how much you're able to bill. That's going to impact how much you're able to earn. So you want to have a pro forma and a financial feasibility assessment as part of your either startup for whole person care or taking a look at where we are now and how we can improve our performance in order to know, when am I going to break even? When am I going to hit a point in time when the margins on return are acceptable to me? And then, most importantly, what am I anticipating as potential losses over the ramp up period of getting to whole person care? And then finally, the third piece is having tools, concrete tools by which to monitor the performance, your financial performance. And so that's really a financial KPI dashboard of some type. We like to work with organizations on KPIs related to, for instance, staff productivity, because that's always a little bit of a wild card, as well as how you do in billing for whole person care services if they're really different than what you've done before and you don't have like coders, special coders on staff. How are you really doing in maximizing revenue on your whole person care program? And then finally, said this a couple times, that the same tools, technologies, and staff roles that you need in order to succeed in whole person care are the same ones that you need to succeed in an alternative payment model. So whether that's an external data source, we talked about HIE, whether it's certain types of care management tools or staff roles that you didn't have before, like care coordinators or population health managers, whatever those things are, putting them in place for whole person care lays a strong foundation for you to be able to assume risk and operate in an alternative payment model. And then finally, that balanced scorecard. of healthcare measures that gives you an ongoing dashboard for assessing the performance of your whole person care practice across a variety of operational domains. One we didn't talk about, but it's absolutely vital, is your consumer and family experience. That's one of the areas where investment in staff, in time, in your practice model, in technology will really pay off in terms of patient volume and repeat visits for individuals receiving integrated services in your clinics. And I'm going to turn it over now to Deanne to talk a little bit about some specific scenarios of operational challenges in whole person care.
Thank you, Christy. So when we are talking about whole person care, it's really programs that provide comprehensive, coordinated care to individuals with complex health and social needs. And when you have that, you're definitely going to come into contact with some challenges that can hinder your effectiveness and your impact. So our first slide that we're going to talk about is key indicators of a lagging whole person care program. Christy, could you forward that for me? Thank you. So one of the first things we'll talk about is low enrollment, and low enrollment rates indicate challenges in reaching and engaging eligible individuals. Really limited outreach efforts or barriers to enrollment may contribute to low participation. You'll also see programs that are lagging. Whole person care indicators of lagging programs is technology not being utilized to its maximum effectiveness. You're not using your tools effectively. You're not using your EHR, your care coordination platform. This can really hinder your communication across your team members and to your patients. You'll also see a fragmented care delivery and inefficiencies if you're not fully up to date and capable in your technology area. If you have a lack of buy-in, whether that's from your staff or the community, it's really going to drag down your programming. You want to include your healthcare providers, community organizations, and payers. And if not, this is going to hurt your implementation and your sustainability. And then going back to resistance to change, that's related to buy-in or skepticism about the program's value. That can really hinder your collaboration and your partnership development, not only in addition to the growth of your program. And then also not really maintaining attention to your revenue. It's going to hurt your financial sustainability and your ability to maintain program operations and resources. And failure to secure adequate funding sources or develop sustainable financing models can jeopardize your program viability. And of course, if you have insufficient focus on your member needs, you're not prioritizing those unique needs and preferences of enrolled members, or you're failing to deliver person-centered care, you are failing to deliver person-centered care if you're not looking towards the needs of those that you serve. Not having individualized care plans or responsiveness to member feedback really can result in that dissatisfaction and disengagement. And then your performance indicators, of course, are extremely, they're vital. And if you're lagging in this area, you may have high rates of emergency room visits or hospital readmissions, which can really signal ineffective care management and care coordination. And then the failure to achieve your desired outcomes, such as improved health outcomes for patients or reduced healthcare costs, really indicates the need for programmatic adjustments and quality improvement efforts. There's some ways that you can look at improving these indicators of a lagging program, include developing targeted strategies to really identify your challenges and then improve your program performance, and then prioritize your stakeholder engagement your technology integration, your revenue diversification, and your member-centered care approaches. It's really a great balance that you have to have, and attention to detail on all of these. And then, of course, implementing continuous monitoring and evaluation processes that track your progress, where you can adapt your interventions as needed. So if you have indicators of a lagging program, of course, you have challenges in front of you. And we're going to talk about that first challenge. Christy, if you could advance one slide for me, thank you, of low volume and lack of engagement. These really present significant challenges for whole person care. And these two we'll explore just a little bit. The consequences of low volume are reduced program impact and reach, limiting the number of individuals who can really benefit from integrated care, and then challenges in achieving your economies of scale and maximizing your resources. Some things that can contribute to low volume include limited awareness and outreach efforts, as well as barriers to enrollment, such as complex eligibility criteria or cumbersome application processes. Ways that you can look to improve low volume includes enhanced community outreach and education to raise awareness of your programming, as well as streamlining your enrollment processes to reduce administrative burdens, not just for your staff, but also for your patients. And then really collaborating with community partners in the community and other healthcare providers to identify and reach eligible individuals and create those referral network opportunities. And when we're thinking about lack of engagement, the consequences of lack of engagement is a reduced effectiveness of your care management and coordination efforts, and then limited opportunities for client empowerment and self-management. And some of the things that could contribute to lack of engagement are communication barriers or lack of trust and rapport between the patients and team members, not having cultural or linguistic, I guess I'm thinking linguini today, linguistic responsiveness and service delivery, and then also insufficient attention to client preferences and goals. These can all contribute to lack of engagement. So when you're looking to improve in this area, you definitely want to increase your training on cultural sensitivity and care delivery, and prioritize that for your staff. And also look to foster the trust and rapport through consistent communication and personalized interaction on different platforms and in different ways. And then also incorporate person-centered approaches like shared decision-making and goal setting. And then just really prioritize your education and support, not only to your staff, but also to your patients, so that they can take an active role in their care. And our next slide, we're going to talk a little bit about the dollars and cents of consumer engagement. And what you really have here is ways how engaging those that we serve impacts our bottom line. So value-based contract arrangements and whole person care incentivize providers to deliver high quality coordinated care while containing their costs. However, many of these arrangements, they require patient engagement to achieve the desired outcomes and to earn those payments. So an example of that is a performance bonus, where providers earn bonuses based on achieving specific performance targets, like quality metrics or cost savings. Patients definitely have to actively participate in their care to influence these metrics, as they're typically included in the denominator of that calculation, not the numerator. An example of this is that a bonus could be tied to achieving a target percentage of diabetic patients with controlled blood sugar levels, requiring that those patients adhere to treatment plans and lifestyle modifications. Now the next one, case rate programs, is where providers receive a fixed payment per member per month for managing a defined population. Now patients are not directly involved in these payment calculations, but their engagement is essential for achieving those desired outcomes and cost savings. An example of this is a case rate program may allocate funds based on the expected healthcare needs of enrolled patients, with providers responsible for coordinating and delivering appropriate care to optimize patient health and resource utilization. And the last one I'll mention here is a shared savings program where providers sharing cost savings achieved by delivering care below a predetermined cost target for a population or condition. What we're looking for here is patients who actively engage in preventative care, chronic disease management, and care coordination that contributes to cost savings by avoiding unnecessary hospitalizations or ER visits. An example of this is providers that share the savings generated by reducing hospital readmissions among patients with congestive heart failure through improving their medication adherence and home monitoring. So you can really see where patient engagement does impact our bottom line, but overall the goal is for improved health outcomes. And by working through each of these different scenarios, you can really determine what's best for your organization and what best serves those that you serve. Our next slide is getting consumers involved. It's not easy. You know, there are a lot of barriers to that, to engaging patients. And some of those include the distance they have to travel or having transportation, language barriers, and being overwhelmed by their number of choices. Some of those patients may have poor health literacy or low self-efficacy, and they may have a lack of a supportive social network. And on top of all that, they may have co-occurring mental health and substance use needs that need to be addressed and can really be exponentially impacted by some of the other barriers that they're facing. Just really, they're only able to look towards their basic needs, and it's up to us to help them through those different levels so that they can really achieve their maximum recovery and healing that they're looking for. And our next slide is talking about, you know, what do you need to do before you build an integrated clinic? Some of you are already there. Some of you may want to expand and grow, but there are some strategies you want to keep in mind to really ensure the success of your whole person care initiative. On this slide, we'll focus on two critical strategies. One is reviewing your data, and the other is involving your current patients and planning. So in reviewing your data, you really want to understand your population, analyze your demographic data, your health indicators, your utilization patterns to really gain insight into the needs of your population. You also want to look at key characteristics and health disparities within the population, such as a prevalence of chronic healthcare conditions or barriers to accessing care. And within that, you want to identify your service needs, those that are most needed by your population or specific subgroup within it, and assess those gaps in service delivery and opportunities for improvement based on the data that you have. And with that data, you also want to look at creative ways to involve your current patients in planning. You can create key informant groups that are a diverse group of current patients that are brought together to gather insight and feedback and perspective on healthcare services and programs, and then facilitate those discussions to identify priorities, preferences, and areas for improvement. Another option is to administer surveys to collect quantitative data on patient experiences, satisfaction levels, and preferences, and then use those surveys to inform your decision making and prioritize initiatives that align with your patient needs and preferences. And then, of course, establishing a member advisory board many times are required as part of your designation. But otherwise, in terms of just being best practice, form an advisory board that's composed of patient representatives and/or community members to provide ongoing input and guidance, and then work with that board to really ensure that you have their input in the co-design and evaluation of those services. And what this does, how this benefits you, is it really enhances your understanding of who you're serving and what those services need to be. And it really fosters your collaboration in the community and builds those partnerships that you're going to need as you grow. And it also, as we well know, improves the health outcomes of those that you serve. And by aligning the services with your patients' needs and preferences, these strategies can really improve those outcomes and satisfaction. And on the next slide, we're on our way. So now we want to encourage the momentum that we've started to gain. And some ways you can do this is participating in health fairs, ones that you create or ones that you participate in, and really normalizing seeking care at your facilities, and making it okay, you know, to stop and get your vaccine or update your annual review or whatever it might be for your patients, being there where they need you when they need you, and then creating those marketing materials that you can use in the community at health awareness months or member education events, meetings that staff go to have available in the office and at those health fairs is very important. And then, of course, training staff and other ways that they can incorporate health into their conversations and work with the patient to really build and develop their goals that are achievable and realistic. And of course, with that, pre-implementation and then implementation, we want to look at growth. On our next slide, patient engagement is just critical, and facilitating that engagement is where you see your improved health outcomes and your patient satisfaction. And growth strategies really aim to expand patient education and engagement efforts and reach a broader audience within the community. Some ways that you can do this is to conduct patient outreach campaigns. You can use your EHRs to identify patients who are due for annual appointments, vaccinations, or preventative screenings, and then launch campaigns that are targeted to encourage patients to schedule their appointments and complete their necessary tests or vaccinations. You want to set enrollment targets with your staff and their outreach efforts to enroll new patients into your program and define specific targets and timelines for reaching out to eligible individuals and then helping them through the enrollment process. You also want to be sure you're conducting reminder calls that incorporate both the healthcare and the behavioral health appointments into a standard call list for reminder calls or outreach efforts. And within those calls, reminding patients of upcoming appointments, screenings, or follow-up visits to really ensure the continuity of care and adherence to their treatment plans. And then you want to reduce the barriers as much as possible. Continuously look at and evaluate the barriers that your patients may be encountering. Take steps to reduce travel requirements or language barriers or paperwork burdens and other logistical challenges that may hinder their access to services. And then really celebrating their success. Collect patient stories, highlight their success and testimonials that really demonstrate the impact of whole person care on their lives, and then track and document those improvements in health outcomes such as better disease management, reduced hospitalizations, or improved quality of life, and then take those and share them with staff, share them with patients, and share them with the broader community to celebrate their achievements and inspire continued engagement and participation. And of course, these growth strategies benefit you all through increased patient engagement, improved health outcomes, and also promoting program sustainability. Our next slide is another challenge. We really picked the two challenges that we see in a lot of the organizations that we work with. Implementing whole person care initiatives involves addressing both structural and people-related challenges that drive organizational change and foster holistic care and delivery. So when you're talking about change management and culture, there are a lot of things that you can really encounter on a daily basis. These are just a few of those, but when we talk about structural issues or challenges that you may encounter, organizationally is one of the challenges that I see a lot in agencies that we work with, because they really have to shift from a siloed disease-focused care model to an integrated patient-centered approach. And that can mean a lot of things. It can mean a change in workflow. It can mean a change in your office setting. It can mean a change in your day-to-day communication or your technology. And doing that can really present some challenges and inhibit collaboration among your staff or between departments or even between the community. And realizing the differences in the workflows is extremely important, and being able to communicate those to your staff and make those come to fruition is really part of the success that's needed to fully integrate a whole person care program. What you see in the people elements can look more like staff resistance, and in a way that they're just not comfortable with this, or they haven't done this before. Why do we have to change? It's working already. Why do we have to do something new? Why do I have to tell this person what I'm doing? So you'll encounter a lot of these, and really communication and feedback is my answer to that, is just making sure that you're communicating to staff on a regular basis, and you're giving them feedback when changes take place. You'll also see a lot of times fear of displacement, or how is this going to impact my job and what I do. And again, communication, really sending out the message of what's happening and why, and when it's going to happen and how it's going to happen is crucial to success, and when you're dealing with the people element of change. And then also making sure that you're really providing the training and skill development that your staff need, so they're informed and equipped with the tools to move forward without questions or doubts. Also, securing buy-in from your leadership is very important, and I always like to recommend too having a champion on your leadership team. who's really the expert in the area that can speak to it, and if anyone has questions, can answer it. Sort of your go-to person that can really support not only leadership, but the teams as they go through these changes, and really setting a clear vision, communicating the expectations, and allocating the resources to really support your implementation and growth efforts. And then maintaining that communication is extremely vital. And then providing that training that we talked about that's tailored specifically to what your staff need and to those that they serve. So with these, you'll have these challenges that are on the right-hand side of your slide. You know, the resistance, the lack of resources, managing expectations. But if you're able to overcome these challenges with some of those things that we talked about today, you'll see organizational resilience. You'll see sustainable transformation, and you'll see program sustainability financially, in addition to those improved health outcomes that, of course, are what we're looking most for. And I'm going to run through the next couple slides pretty quickly. At Open Minds, we've identified 6 assessment domains for whole person care that we can look at and really identify where an organization is in their journey to whole person care, and help them move through these domains and through to the model that they really want to be at. And these are all areas that are really successful for really important for successful implementation and sustainability of a whole person care initiative. So the 6 domains that we have, the first being the model, along with market and financial feasibility, we really look to assess alignment with patient care principles, patient-centered care principles, also the integration of medical and social services, and a focus on addressing social determinants of health. On the market side, we like to evaluate the market demand and community need for whole person care services. We look at the population demographics, health disparities, and utilization patterns. And then for the financial feasibility, we really want to look at a cost-benefit analysis, your revenue projections, and reimbursement considerations to really make sure that you're on the right track for where you want to be. The second domain is leadership and culture of integration, and that's where we assess the leadership commitment and engagement, as well as evaluate the organizational culture. The third domain is financial planning and management, where you want to look at your development of a comprehensive financial plan. We would look at your funding sources, your billing allocations, or your budget allocations, and revenue streams, and then really establish those financial management strategies. On the fourth domain, care delivery and care coordination, we look to assess the care delivery models, looking at your current delivery processes, your care team configuration, and workflows that are within those, and then address the care coordination challenges. The fifth domain, information systems and population health, is where we look at assessing the capabilities of your existing EHR, your health information exchanges, and your data analytics tools, and also look at your population health data to identify those high-risk populations, health disparities, and social determinants of health to inform your interventions and your resource allocation. And the last domain is patient, family, and community engagement. That's where we look at assessing your patient engagement strategies. We evaluate mechanisms for involving patients and families and caregivers in planning and decision making, and really also look at your community partnerships and engagement there. And our next slides give you a nice overview. These are really reference slides for you all. You can look at where you are and sort of see where you need to be for staffing on this slide based on the model. And then the next slide is specific towards technology, where you need to be technology-wise in order to move forward And it's a nice overview of where you are now and where you could be. And then the next slide really, it's our 3R slide. So integrated care payment models, they really require careful consideration of what we call the 3Rs, the risk, responsibility, and reward. We really could spend an entire hour just on this slide. But just to say here, these 3 areas need to be addressed and considered, and by that way you can optimize your effectiveness and sustainability of your integrated care initiatives, and look at those improved outcomes for individuals and populations. And then one of the last slides I'm going to talk about today is what a high-performing whole person care practice looks like. And it starts with a plan. You know who your population is, who it is, what their needs are, what they look like, the services that you're going to offer, and what those are. And you have your partners in line, or you know who your partners need to be. And then you have that best fit plan in mind for where you want to go. So you start with a plan, and then our next slide is you have your model in mind. So this is really a list of all the different ranges and levels you could be on when it comes to integrated whole person care. And it's a great way, reference that we use when we're assessing different organizations to really determine where you fit in, and then talk about where you'd like to go. So Christy, with that, I think that was my last slide. I'll turn it back over to you.
Thank you, Deanne. So I'm going to just spend our last few minutes, and then we'll take questions as available, doing a quick intro to the Open Minds Integration Performance Assessment. You saw the list of, Deanne went through in some detail the list of domains that are part of that performance assessment. Let this thing go forward. There we go. The value here of being part of an integration performance assessment is it really gives you the opportunity to strategize on here's where we are today, where do we want to go next, and how do we optimize our current resources, staffing, technology, etc., in order to be able to achieve that goal. So part of the assessment with the domains is identifying what are the tools that are needed or the steps you need to take. It can include anything from management reports and screening tools, for instance, or some best practice care coordination and care management protocols. And then really, what are the different staffing, technology, and reimbursement models that best align with where you are today, your next step along the whole person care pathway to where you want to get to ultimately in delivering integrated care, because there's a different staffing, tech, and reimbursement strategy that goes with each of those steps along the way. So the Open Mind team, we always start with an assessment. So we use those domains and a structured tool to come in and identify how our operations now, where are the things that maybe need to be slightly retooled, tweaked, or fixed in order to make sure you have the ability to grow, replicate your programs and services in different settings, and to achieve financial sustainability. So part of this, again, goes back to that plan, is sometimes organizations are in the wrong whole person care model, and they need to be looking at a different level of the types of integrated models that Deanne showed you earlier, which can be the model itself, it can be the services and how they're configured and delivered, how your organization operates in the background, which is the whole organization. It includes things like HR and compliance and finance. What are your technology needs? What will you need? What kind of staffing today? What will you need? And then again, that whole financial feasibility process in order to get to sustainability. And then from that, we really develop a very specific action plan to help that organization get to the next level, to where they want to be. A piece of the Open Minds process is very individualized consultation with organizations who are thinking about a strategy or have adopted a strategy, but really want to lay out their developmental path into the future, the next 2, 3, 4 years, where do we want to be along the way. So a big chunk of it at the beginning is assessing, as Deanne said, your market. So what is happening in your market? What is your organization today? And how do we match that up with a whole person care model that's a best fit for where you are today? And then that vision for the future. It also identifies specific practice needs. So we showed you, high level picture of what staffing could look like at different types or different levels and models of integrated care, as well as technology needs at different levels. You do the same thing around licensing. You do the same thing around the reimbursement model that best fits your organization on that developmental and evolutionary path to whole person care. Implementation planning, feasibility testing, we talked about that particularly in the financial sense of the importance of financial feasibility testing, so that you know what's your trajectory to get to break even, and where beyond that till I'm getting a return on investment that's acceptable to me as an organization. And then of course, what technology do you need along the way? So we offer a learning track. We actually have one coming up in Long Beach in August at our Operational Excellence Institute, where we'll have a whole day learning track on different aspects of whole person care. We have the assessment that we just discussed, the action plan we just discussed, and then a really big focus on the market that you're in, not only at that initial stage of choosing your model and your population, but at the end stage of contracts that we seek with payers, community organizations that we want to partner with, patient and family engagement. All of that is market outreach, and you really need a plan for how you're going to maximize that in order to get the patient volume to grow and to thrive. And then finally, of course, growth and replication strategy. How do we want to expand and grow into the future? I'm going to skip through. These are just some pieces that'll be part of the deck for you on how we deliver this, but this is really the slide I wanted to share, which is it's all about having a vision for your integrated care services and then backing that up with a very structured process over a 2, 3, 4, 5 year period of time on how we're going to get there. And when you look at this model for developing a new service line like whole person care or improving a line that you currently have, you'll see right at the start, feasibility analysis is an important piece. And then really getting that plan in place to launch the services and then monitoring them over time. I think with that, we wanted to turn to our audience and see if there are, Corey, any questions or anything from the audience.
Yeah, Christy, Deanne, thank you very much. We did get one question. If anybody has a second question while we answer this one, you can submit that. It says, for your Open Minds assessment, do you have variants for nonprofits, or is it geared mostly to for-profits?
Deanne, you want me to go? This is for anyone. I think one of the areas I didn't really point this out during the presentation of the slides on the survey we conducted in 2023, there was a category for organizations that only want to do social determinants of health, screening, referral, and care coordination around social determinants of health. So that's a model too. So, many pathways to whole person care, and this assessment process can be used effectively with any of those pathways and any type of organization.
Well, it looks like that's brought us to the top of the hour. I want to thank Christy and Deanne for this very detailed presentation. I want to thank everybody who joined us. And And I want to remind everybody that the slides and the recording for this will be made available on the Open Minds website starting tomorrow. In addition, early next week, I will reach out to everybody who registered with a link to those resources, as well as some other Open Minds resources on integrated care, whole person care. Also, if you would, you can join us for our next roundtable, Thursday, May 2nd at 1 p.m. Eastern, Rethinking Your Business Model for Strategic Organizational Redesign. You can register for that event or look at our full upcoming roundtable schedule by visiting the Executive Roundtables page under the Events tab at www.openminds.com. Deanne, Christy, this has been great. Thank you very much, and I hope everybody has a fabulous weekend.
Thank you.